It's all about the health of the mother and child on this week's edition of Health News as we reach you from the Central Hospital here in Warri, Delta State, where this expansive maternal and child health center will be commissioned for public use. Thank you so much for joining us. I am Yomi Otaigbe. There are 65 general and central hospitals in Delta State and over 400 primary health centers where maternal and child health services are rendered. Today the women are here already, and we expect that these chairs will be filled up with people who have come to witness the commissioning of the first hospital dedicated to women and children in Delta State. People in and around Warri and its environs arriving at the venue. Soon, the seats are taken up. Then the arrival of the Olu of Warri, His Majesty Ogiame Atuashe II, and the Delta State Governor, Dr. Emmanuel Uduaghan. It's a day they've been looking forward to, one that is set to be the first of others to come. The commissioning of the Maternal and Child Care Hospital at the Central Hospital premises in Warri. Just before the main event, the Delta State Governor, who is a medical doctor, takes some time out to engage the pregnant women in a language they best understand on the need for family planning, and not just to come for antenatal care, but also deliver their babies in hospital setting.
If you don't go, you won't begin before, put up your hand. If you don't want to before, put up your hand. Okay, put down your hand. If you don't want three before, if you don't want three before, stand up. Go correctly all this wall safely. Jesus' name. That means for this one now, before, not this one. After this one, what come here again? The only reason why you come here again, you say you don't do family. And yes, so after the fourth one, you must do family planning. That is number one. Number two, we have to see, one of the things that they did well, you see, as you get the belly, you go register. As you go register, yes. Then, nurse, midwife, will take care of the belly. I'm not sure I'm for you. And some doctor will sit there. So between the midwife and the doctor, they still have to hear. Anyone when it gets more problem, they go to start. Not so. Yes. Yes. So, first of all, now we say you are supposed to be born regularly for waiting. You are supposed to be born regularly for. If you don't come to the antenatal, I won't come to you. So, based on the form for antenatal clinic regularly. After that, one that they labor are person that I don't want you to pay for myself. You know, I must try and come for my certificate for here. Now, yes, sir? Yes, sir. Because many of them now became the men who are later, are free, and later are free. Okay, then they come are free. After that, on the delivery, now the one who won't buy all the rock, and then Sarah to family. All the facilities deliver safely.
After that short enlightenment talk, the governor is joined by the Olu of Warri and other guests for the official opening of the new maternal and child care hospital that is linked to the existing health program for women and children in Delta State.
For the use of our people and for the glory of God. Our official resolve to protect the lives and health of our women and children led to the establishment of the free maternal health program in 2007 and the free under 5 health care in 2010. fueled and sustained by the passion to further protect lives of our women and children, has led to the establishment of this ultra-modern edifice we now call the Maternal and Child Care Center. This modern health facility is equipped with state-of-the-art medical equipment and is staffed with commensurate quality of manpower that can provide tertiary-level maternal and child health care. It has the capacity to accommodate 400 patients at any point in time. So with this commissioning, this center becomes operational, which is already going. We'll be stepping into a new level in the annals of maternal and child care in a rich history of healthcare delivery in Delta State. With this new center, we'll be better positioned to achieve the MDGs as related to maternal and child care by the year 2015.
In our center, in 2006, the antenatal care uptake was 18,000 and delivery was 2,000 in this hospital. But by 2008, 1 year after the initiation of the free maternal care services, we had over 3,000 deliveries in this hospital, and then antenatal care uptake had increased significantly to 26,000 from 18,000. Now by 2013, the antenatal care uptake had increased to 33,000. That is 50% increase in delivery rate and over 42% increase in antenatal care uptake. Obviously, there was need for expansion. In the former facility where we were, we had 2 standard delivery beds and 8 first stage beds as it was. In the new delivery that we have moved to, we now have 6 standard delivery beds with capacity for expansion to 9, which we did not have previously. So women will be delivering 1-to-1 in a room, attended to solely by nurses, as in our previous facility where delivery was open to everybody. You know, that's what you have in general hospital settings. You know. Then again, we have facilities for children. Our SCBU, Special Care Baby Unit, was a bit distant from the labor ward theater and the labor ward itself. Now, which meant that we had to use transport incubators to transport babies that needed SCBU care, Special Care Baby Unit care, from the labor ward theater and the labor ward to the children's ward. But in this facility, that does not happen. Our SCB, Special Care Baby Unit, is just on top of the delivery of the labor ward. And so we have shortened the time space between movement of a baby who requires Special Care Baby Unit and what it was previously. Additionally, we have 2 state-of-the-art theaters in this facility as against 1 theater that we had previously in the other facility. Now, when you know that our cesarean section rate is about 25%, you can understand that 1 single theater in our previous facility cannot serve us here. Now, again, we have more incubators in this facility compared to what we had previously.
Since we started the program in 2007, when we started, the maternal mortality rate was about 456 per every 100,000 pregnancy and deliveries. But since then, in 2008, it fell and it's been falling gradually. Today, it actually fell to about 212 in 2011. In 2012, it moved slowly to 242, but we have been able to achieve at least 50 to 60% reduction. And then we hope that in 2013, which we're still collating the figures, we are very hopeful that it will be about 150. Because of the data we're collecting, it's not just within the hospitals alone. We collect data from all the hospital, private hospital, maternity homes, the primary healthcare centers and comprehensive health centers, and across the state. So we're on it. Before the end of March, the figures will be out.
Improving maternal and child health involves a lot.
The care we render is that when the women are pregnant, they come to the antenatal where we look after them properly from during the pregnancy to even after birth, giving birth. The nurses in antenatal care for them and care for their baby as well, giving them health education on nutrition and on personal hygiene, what they are to take and what they are to engage in. The mothers also are being treated, are given free drugs that is being provided under this scheme. And The nurses do their temperature, vital signs, what we call vital signs, temperature, pulse, respiration. They also do the weighing of the mothers. People that are even yet to be pregnant also have, because we have gynae emergencies, we have gynae cases that we take care of. So if they are pregnant, they have a problem, or they are not pregnant, unable to get pregnant, we have doctors and we have nurses that care for them and take care of them till they get pregnant. Yes, we render such services as well.
For the mothers and soon-to-be mothers, the new maternal and child care hospital is a step in the right direction.
The turn up in this place compared to what they used to have before, we have the place is overcrowded. But having it a big place like this, it will be able to accommodate the number of people that will come. Then, especially when it comes to maybe when a pregnancy that is of problem nature. When it comes to all those CS of 18, all the facilities they give here, the delivery, everything, even said they give this delivery pack.
They're very beautiful, very fine, and they're very good. And I like it like that.
Liking the hospital facility is one thing, but as observed earlier, the government, while encouraging the women to come for antenatal and postnatal care, needs to regulate the activities of the traditional birth attendants whom some of these women go to for delivery.
Talking about TBAs, before now we have always looked at it as something that we should outlaw. But you see, we have made all these access available. No person pays a kobo from the time of pregnancy to the time of delivery, to even 6 weeks after delivery. You know, when they are completely discharged from the hospital. But in doing this, some people still go to the TVAs because they have faith that that was where they were delivered. We are looking at a proper supervision where registration can be given, particularly the referrers. Yes, they can take delivery, but they still need to know signs of danger, what their capacity, what they can do and what they can't do, and in the process. So that coordinating body will be reporting to, in my ministry, we'll be reporting to the commissioner, and then we monitor them, and then we give them a code of conduct. This is the way you will operate. Anything beyond this, the person will be sanctioned, and we need to register them, on a yearly basis, so that those who are not meeting up with those referrals and looking at those difficult cases, those that records high number of deaths as a result of non-referral, we sanction the person.
Away from issues around the TBAs, the Delta State Ambulance Services is also launched in the Central Hospital, Warri, as part of life-saving measures. The governor and his entourage proceeding to another part of the Central Hospital to unveil the doctors and consultants office complex.
The glory of God.